And then we take an update from the Honorable Minister of Environment before we switch over for the questions session, and then we take the responses. At this point, let me invite the Chairman of the Presidential Task Force on COVID-19 and Secretary to Government of the Federation to please come to the podium to present his remarks. Chairman, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, I welcome you all to the national briefing for Monday, 22nd June 2020. At the beginning of the month of June, the Presidential Task Force announced a 1-month period for the implementation of the second phase of eased lockdown. We have continued to monitor developments nationwide in order to take informed decisions at the end of the month. We have exactly 8 days to that point of decision. While pursuing that line of action, the Presidential Task Force would like to re-echo the World Health Organization advisory to countries and their citizens not to equate any slowdown in numbers accompanied by loosening of restrictive measures to translate to a reduction in the dangers faced by humanity. Yesterday, 21st June 2020, Nigeria crossed the threshold of 20,000, with our total number rising to 20,244 confirmed cases. This signifies to the PTF that more testing has been carried out in recent weeks. However, we are not deluded that we are getting enough samples to test. I wish to remind all our citizens that the best strategy remains to test, detect, isolate, and treat. That has accounted for the massive expansion in the laboratory network and testing centers. Now we have 38 spread across the nation. The Presidential Task Force has also continued to watch developments from other jurisdictions, especially those that have similar climatic and demographics with us. Here, Brazil is of particular interest. You would have observed that the number of confirmed cases in Brazil have risen to over 1 million, thus becoming the second highest in the whole world, and reporting over 50,000 deaths. In Africa, the World Health Organization has reported that South Africa, Egypt, Nigeria, and Ghana have proportionately been the most affected countries on the continent of Africa. All these combined represent a serious wake-up call for us all to be responsive and to take full responsibility for our actions. Ladies and gentlemen, our failure to take responsibility threatens the gains we have recorded, which is not good for our large population. Let me give you a vivid picture of how this virus has spread across our nation by timelines. In April 16, 2020, we had a record of 442 cases. By May 16, 2020, barely a month, the figures had risen to 5,621 cases. And by June 16th, another month, thereafter, 2020, we had on our records of confirmed cases 17,148 cases. By today, we have on record, like I said in my earlier paragraphs of my remarks, over 20,000 reported cases. We really have a choice to make, and there is an urgency of yesterday in our choice. As part of our collaboration with the states, the Presidential Task Force team made up of the DG, Nigeria Center for Disease Control, and the WHO representative visited Plateau, Edo, Lagos, and Akwa Ibom states to assess the state of preparedness and control. The visit further gives us the confidence that sub-national governments are also taking the necessary actions to ensure that this fight is speedily won. I commend our state governors who have been responsive and responsible in taking up the task of sustaining the containment of COVID-19 in their states. The DG would, I believe, in his remarks, give you updates as to their findings and the encouraging news that they got and what they saw on ground during the course of their visit. On Saturday, 20th June 2020, we received the first batch of equipment supplies under the One UN basket. These supplies included personal protection equipment, testing kits, and laboratory equipment. I want to use this opportunity to thank the partners of the One UN basket and to look forward to receiving the second batch of these supplies. Their commitment greatly shows that partnership is the most important ingredient needed to overcome this pandemic globally. I similarly wish to thank the World Health Organization for the donation of oxygen concentrators, which has become very vital for case management. Also over the weekend, the Rotary Club International District 9125, a long-standing partner in the fight against polio disease, made a donation of essential materials worth over 10 million naira to support the fight against COVID-19. This gesture is also very much appreciated. The Presidential Task Force is pleased to express its appreciation to the National Association of Resident Doctors, NAD, for demonstrating the spirit of patriotism and understanding by calling off the industrial action its members embarked upon. Abiding by the Hippocratic oath further gives us comfort that we would win this fight. On the part of government, we would continue to ensure the welfare and safety of all workers will never be neglected. As we pursue the community engagement and risk communication strategy, the Presidential Task Force has identified lack of information about case definition protocols, location of testing centers, inability to reach call centers as obstacles to getting needed help. The Presidential Task Force has therefore directed that more awareness be created on the location of testing centers and how to get tested, especially when you fit the case definition. The call centers are also being re-energized for responsiveness. Our messaging on risk communication and compliance by the public will also receive very strong attention. We must develop a national wave of awareness creation to drive home our objectives. I therefore urge Nigerians to make use of these facilities and get tested. Similarly, I implore us not to be afraid of undertaking the COVID-19 tests. Testing positive for COVID-19 is not a death sentence, but failure to test, especially when symptoms are evident, could result to death, as it may be too late once the symptoms become full-blown. The loss of any Nigerian is not only painful, but most avoidable provided we seek early help. The Presidential Task Force is also not unmindful of the possibility of imports, especially through our land borders. For this reason, our men and women of the Nigeria Immigration Service remain vigilant, and this has resulted in the apprehension of 2 foreigners who tried to enter the country illegally over the weekend. This commendable effort is appreciated by men and women who are working tirelessly to ensure that they safeguard our borders and our territories from further importation of the virus. The declaration of Nigeria as polio-free nation last week is a welcome development, and we congratulate all those that participated in the long-drawn battle to rid Nigeria of the disease. This declaration is a signal that overcoming COVID-19 and indeed any other infectious disease is possible and shall be achieved. We use this opportunity to renew our call to the medical practitioners and hospitals not to neglect other diseases and ailments because of COVID-19. Finally, let me remind everyone that wearing your mask properly, observing social distancing, washing your hands, and avoiding large gatherings are critical to saving lives, including yours. Observe them religiously. I now have the honor to call on the Honorable Minister of Health, the DG, Nigeria Center for Disease Control, and the National Coordinator to update you on progress made and any other new issues. I thank you for listening.
Response. Honourable Ministers here present, the National Coordinator, Director General, Directors, Permanent Secretaries, ladies and gentlemen, I shall be re-echoing a lot of what the Secretary to the Government of the Federation has said, particularly in relation to the health sector. The confirmed cases of COVID-19 in Nigeria surpassed the 20,000 mark over the weekend, reaching 20,244 between yesterday and today. We also saw the highest number of daily diagnosed new cases last Thursday at 745, but over the past 24 hours, 436. While the overall trajectory was predicted as the course of events, explained both by increased community transmission and rising testing capacity, it is a reminder that we must not only not let down our guards, but begin to re-strategize on additional measures of getting control of the situation. This will not be the sole responsibility of government, but of all citizens, individually and collectively. It is also the prime feature of the national COVID-19 Health Sector Response Action Plan of the Federal Ministry of Health, which tries to map a near, medium, and long-term health sector response strategy to the challenge across all areas of health over the next 3-year period. The plan is to be presented at the National Council of Health and applied to states for the development of state-specific action plans to address state peculiarities. As at yesterday, 6,879 persons in total had been treated for COVID-19 and discharged, while 518 in total have sadly been lost, with 96 persons in just the past week. Total samples tested are 113,575. Active cases are 12,847. Our case fatality rate is 2.55%. The experience we are making suggests that some of the fatalities recorded in our country may possibly have been saved if they had arrived designated treatment centers early enough. It is also emerging that the clinical condition of COVID-19 patients, especially the elderly and those with underlying illnesses, which we call the vulnerable, can change from mild to critical within such a short time that patients hardly have time to seek hospital care. I therefore again advise all hospitals to have the right index of suspicion and recognize and promptly refer suspected cases to designated treatment centers. Attempting to treat COVID-19 positive patients when not so accredited wastes their time, puts them in danger, and also puts all others involved at risk, including the innocent, other patients, staff, and personnel. I also advise persons with symptoms and those with underlying diseases, particularly also the elderly, to check into an isolation center for observation if diagnosed. This could save your life. Though up to 80% of cases can be asymptomatic, it helps to also bear the known common symptoms in mind, these being fever, cough, sore throat, runny nose, difficulty in breathing. Additional signs can be headache, diarrhea, nausea, and fatigue. While symptomatic treatment can be vital in preventing complications, close clinical observation in the center early enough can be decisive. The National Association of Resident Doctors, who embarked on strike a week ago, have happily suspended their industrial action following continuous dialogue, constructive engagement, and response to grievances that were tabled, like payment of hazard and inducement allowances and provision of personal protective equipment. In connection with that, we are happy to say that Nigeria received a large consignment of medical supplies on Saturday, the first of a series of deliveries from the United Nations Group in Nigeria and the European Union, which several ministers were on hand to receive at the airport on behalf of the federal government. The donation is very reassuring to us because we can now make up our stockpile, and it is made up of a large number of various categories of personal protective equipment and 547 oxygen concentrators, courtesy of the World Health Organization, which our experience in Nigeria shows are more in use than ventilators. The Federal Ministry of Health particularly appreciates this addition to our case management assets, and we thank all the donors through the resident coordinator of the UN family in Nigeria, Mr. Edward Kalon. I was invited to visit the 063 Nigeria Air Force Hospital last Friday to inspect the COVID-19 Observation and Treatment Center there, a modern 25-bed center with facilities for managing mild and severe cases. An additional 200-bed hostel has been prepared as a backup isolation center in case of overspill. The center will complement the treatment centers in the Federal Capital Territory, which are able to handle isolation type 2 and 3 cases. I must commend the Defense Headquarters and the leadership of the Nigeria Air Force for the offer of support in the fight against COVID-19. The Air Force already supports the Federal Ministry of Health with mission flights to various parts of Nigeria. Departing from COVID-19, on Thursday, the 18th June 2020, the World Health Organization's Africa Regional Certification Commission for Poliomyelitis Eradication announced the pending certification of Nigeria as a polio-free state, an achievement worth celebrating considering that up to 2012 we accounted for about half the polio cases worldwide, and that we missed this distinction narrowly in 2016. The credit for this is due to all tiers of government, to our international partners, community leaders, and above all, the thousands of National Primary Healthcare Development Agency frontline health workers and resource groups. I particularly wish to commend and thank His Excellency President Muhammadu Buhari for his interest, his commitment, and his unalloyed support for this program. The certificate will be delivered in August, but it does not mean we are resting on our guards. Our energy is already being redirected to supporting the fight against COVID-19, especially in this community transmission phase, with the community support program of the National Primary Healthcare Development Agency, using the Primary Healthcare Network, Primary Healthcare Center Network, and the experienced Human Resources for Health to drive surveillance, community case management, community engagement at grassroots level. I am mindful that in this regard, other health services like routine immunization, antenatal care, care for malaria and other ailments shall be maintained to ensure that our indices do not drop while we still stay polio-free. We must daily be reminded of challenges that COVID-19 poses to Nigeria and to the world, and to further reinforce our resolve to tackle the pandemic. We can reduce case fatality in Nigeria if non-pharmaceutical interventions are adhered to and scaled up, and if we become more proactive in dealing with the cases that we find. We can scale up testing, tracing, treatment, and isolation. And in that regard, we need the cooperation and collaboration of all citizens, but with priority on offering more protection to elderly citizens and those with comorbidities from threat of infection. Thank you for your attention. And I now invite the Director General of
Thank you, Honorable Minister for Health, Secretary to the to the government of the Federation and Chair of the Presidential Task Force, honorable ministers, members of the Presidential Task Force, gentlemen of the press. Thank you very much for the opportunity again. Today, we'll present to you some of our findings from a tour around 4 states in Nigeria, Akwa Ibom, Plateau, and Edo states. We went to these 4 states. We started with Plateau on Thursday, Edo on Friday, Akwa Ibom on Saturday, and Lagos on Sunday. The purpose of this trip, as always, is to engage with the leadership of the state governments. A lot of the work that we're doing on this outbreak has to be focused on the states. That's where the outbreak response is driven from, and we always have to go to the states, understand how they're doing, learn from their response, encourage them, and develop new strategies of working together. Also, it's always an opportunity to gain a better understanding of the situation on the ground, the differences in the different approaches in the states, learn from each other. Firstly, I'd like to really thank the Nigerian Air Force again for their incredible effort. When I say we've gone to 4 states in 4 days, it wouldn't be possible without the support that they have continuously provided to this response. So, in the last few years, we've worked very hard to support every state grow its preparedness and ability to respond to infectious disease outbreaks. Slowly and quietly, we've been training healthcare workers, supporting the setup of emergency operation centers, supporting the deployment of a new surveillance infrastructure, supporting the establishment of new treatment centers. So this COVID outbreak, as difficult as it has been for the country, also provides us an opportunity to drive these developments even further. It's also gratifying to see that many states have learned from lessons in their own response to the outbreaks they have faced in the past and use this capacity to respond to the current outbreaks. These investments have helped the response to this outbreak and enabled many states not start from zero. I think the state where this exemplifies it more than any other is in Edo State. Edo State historically has suffered from Lassa fever outbreaks. We all know about that. But in the midst of that, they've also developed the Rural Specialist Teaching Hospital, one of the premier hospitals that has developed the capacity to respond to infectious diseases. But beyond Irua, we saw and met a very dedicated team at the University of Benin Teaching Hospital led by Professor Baseki at the Stella Obasanjo Hospital in Benin, and really saw a committed set of clinicians that were working very hard, innovatively to deal with the challenge in front of them. But really most gratifying was the leadership of the governor of Edo State, Governor Godwin Obaseki, in how he had driven this response, personally led EOC meetings every morning to deal with the outbreak, understand the data, and use the data to respond to the outbreak. Another innovative approach we saw in Edo was the inclusion of the Edo diaspora in various universities across the world to help understand how they were responding. So really impressed by the work going on in Edo. Of course, there's a lot of work, a lot of improvement possible, but I think they've gone a long way and we have to encourage them. They've been testing a lot of people, we're getting the results, and we're fairly confident that if they keep pushing as they are, we'll get on top of this outbreak in Edo State. In Plateau, we went primarily also to commission a new treatment center at the Bingham University Teaching Hospital. This treatment center was funded by the Basic Healthcare Provision Fund, which was established a few years ago, and the development of this literally was because of the increased number of Lassa fever cases in Plateau. So these cases of Lassa fever had led us to making a small investment in developing the capacity to treat that. We didn't know that they would need this center for the management of cases of COVID. So that's another example how investments in health preparedness in one area supports health response in another. In Plateau State, we also visited the National Veterinary Research Institute in VOM, one of the historical centers where infection control has been led on the animal side. That is now one of the premier testing centers for a disease that is affecting the health of humans. So this collaboration between the animal and human sectors, as part of our One Health strategy that we've been implementing in Nigeria for many years, again shows you some of the developments that have been happening quietly in the state. So again, very grateful for the leadership of His Excellency Governor Simon Lalong, whose leadership really is driving the response in Plateau State. Well, not finally, but penultimately, we went to Akwa Ibom State. And to be honest, the level of investments by the state government in Akwa Ibom is probably parallel to no other. They've built a brand new treatment center, a brand new lab, a brand new EOC, all with state government resources. So really investing aggressively in public health in a way that probably would not have been fathomable many years ago. But it also shows the level of seriousness that states are now taking this problem with and actually investing money in the response. So we're privileged to go around these new centers, the new lab, new EOC, new treatment center, and really congratulate His Excellency Governor Udom Emmanuel on the investments made in Akwa Ibom. It's very critical and was really gratifying to see states taking responsibility, investing their resources, working with the federal government on this very difficult outbreak. We ended up with Lagos. It was a short visit in Lagos. We were swapping teams. A team was coming back, a new team had taken over. So the visit in Lagos was really to encourage them. The teams have been there for quite a while now to keep pushing and supporting Lagos. So I'd like to conclude by saying that, yes, the states in Nigeria vary by their capacity, by their circumstances, by the realities. But there's a lot of best practice coming out from the various states, how they're leveraging on previous investments, leveraging on federal government institutions, leveraging on the private sector, leveraging on their diaspora in this response. So we're really learning from each other. But really, the part that will stay with me the longest is visits to the treatment centers. I really saw clinicians working extremely hard. My discussion with the clinical leader of the University of Benin Teaching Hospital, who started up the treatment center in that hospital. When he started, he was the only physician with the courage to start. Slowly, other people came on and joined, and I see them working 12, 15 hours in this fight. And really, as tired as we might be in carrying out the things we need to do, we're really encouraged by the courage and the efforts by our clinical leaders. I must say the one area that worried us the most as we traveled around the country is that we still struggle to see sufficient people wearing masks. We still saw gatherings of too many people in a place at a time. And we know that across the country, we're struggling with this. And I really want to encourage all Nigerians. We can't treat our way out of this. We simply can't. We have to prevent. It's the only chance we have. So as we work hard, as we congratulate those treating, we must take responsibility for prevention. It's in our hands. Let's take responsibility collectively to get out of this outbreak. Thank you very much.
The chairman of the PTF, honorable ministers and members of the PTF, gentlemen of the press, good evening. So today I'll be talking about sensitization activities and some of the observations that have arisen from these activities. As you are aware, the government continues to ensure the containment of COVID-19 in the country by equipping Nigerians with life-saving information through multiple platforms. We are grateful to the National Orientation Agency and in particular the DG for their engagement and very strong commitment to the cause of COVID-19. They have developed numerous video and audio awareness jingles on COVID-19 that have been distributed in English, Hausa, Igbo, Yoruba, Pidgin, and several other languages across both the traditional and the new media channels in all states of the Federation. They have also been working across all 774 local governments in the country, together with us, donor partners, other civil society organizations, and other stakeholders for grassroots sensitization campaigns. Some of the observations that have arisen from these activities include the fact that Nigerians have continued to show persistent and remarkable lack of compliance to COVID-19 prevention protocols, which is quite worrying, really. In the cities where adherence to these protocols were high in the initial 2 weeks of the eased lockdown, progressively over time, citizens are letting down their guards, and this remains of grave concern. There is partial to total non-compliance with face mask and physical distancing protocols by the public, as earlier mentioned by the DG NCDC. Many Nigerians only use their face masks either to avoid security agents, or that is where enforcement exists, or where they are told to do so. There's also significant disbelief in the danger and impact of COVID-19. In parts of the southeast where we did a recent survey, 60% did not believe that COVID was an issue at all. We clearly are not taking the pandemic seriously enough. There are also many myths that continue to exist within the social media platforms, ranging from conspiracy theories to get-rich-quick gains, to claims of treatments by herbal concoctions, etc., all of which appear to be really putting our sensitization efforts at risk. There are, of course, ways that we can mitigate this, and this includes sensitization and awareness creation through a collaborative effort with the other levels of government, collaboration between the PTF and the state task forces in strengthening continuous engagement, training, and distribution of sensitization materials. And this is only one way by which we can continue to try and flatten the curve. It's important that Nigerians continue to observe strictly the hygiene and safety measures approved by health authorities to avoid contracting the virus, especially as community transmission is on the rise. As I said last week, today, now, you are more likely to contract COVID if you go out and do not observe the strict measures that we recommend, far more than when this problem started 3 months ago, simply because of the numbers that we are currently having. We must all join hands to adhere and spread the message of wearing face masks, learn to challenge those that are in public and are not wearing these masks. We will continue to enforce and introduce measures for enforcing some of these measures, particularly for organizations that are responsible, such as shopping malls, etc., that do not take these seriously. We are also working very closely with security agencies as well as the state governments to try and introduce edicts and acts that will enable us to make face masks mandatory, the use of face masks mandatory in the public space. In terms of the state governments, we do have a message for the state governments. First of all, to recognize those states that continue to support the program, that continue to work very closely with the PTF and the task and the rest of the response to make sure that our citizens are kept safe. We would like to thank them for supporting their state emergency operating centers, thank them for providing operational budgets, and also pushing for more testing, because there is no shame in having a positive result in your state. It's much better for you to know the level of COVID infection you have in your state. Denial will only make the issue more difficult, because we cannot run away from the fact that this is a pandemic. if we do not know the true state of the pandemic in your state, not only are you putting your citizens at risk, but you are also putting your own healthcare workers at risk. And if your healthcare workers are at risk and become infected, your entire health system could collapse, and you're going to have a lot more deaths from people that don't even have COVID presenting to these hospitals. So in the long run, it is in the best interest of all of us to make sure that we know the true extent of the pandemic by continuing to push for more tests, rather than by trying to avoid testing citizens. Let us accept that COVID is here with us. We need to address it. We need to fight it. And the first step in fighting it is knowing the extent of the problem you have. And I hope we'll continue to work with state governments, all of them, to make sure that we take all the necessary measures to protect our citizens. Thank you.
Honorable Minister, Environment.
Mr. Chairman, members of PTF, distinguished ladies and gentlemen, gentlemen and ladies of the press, good evening. I will simply repeat and reiterate what is happening, but in Hausa. People seem to be taking this lightly, thinking that the lockdown are being eased. Well, big mistake. Jama'a assalamu alaikum. Muna so ne yau mu jaddada akan maganan ilmantarwa da faɗakarwa akan abin da yake faruwa da ita wannan cuta ta corona. Mun lura mutane suna ganin cewa abin yayi sauki ko ta tafi. Mutane sun fara yi ƙa'idojin da aka gindaya rikon sakainan kashi. To ina so mutane su sani, an wayi gari a cikin ƙarshen wannan makon da ya wuce, adadin mutanen da suka kamu da wannan cuta ya haura 20,000. Amma kafin ma ka san ma'anan wannan haura 20,000 ɗin, mu koma cikin watan 4, wato watan Afrilu 16 ga shi, a lokacin waɗanda suka kamu mutum 400 ne da wani abu. A cikin watan Mayu 16, wato bayan wata ɗaya rak, yawan adadin mutanen da suka kamu ya yi tsalle daga 400 zuwa 5,000 da wani abu. Sai kuma daga cikin watan Mayu ɗin zuwa watan Afrilu zuwa watan Mayu, sai muka ga kuma wannan adadin ya ƙara yin tsallen baɗake zuwa 17,000. Me wannan yake nufi? Idan muka ci gaba da rashin bi da rashin kula, kenan kowane wata ɗaya adadin waɗanda suka kamu zai ninka kashi 3, kashi 4, kashi 5. Kenan haɗarin da ke tattare da yiwuwan ka haɗu da wanda yake da wannan cuta ka kamu yana ƙaruwa ba kaɗan ba kuma. Idan muka ci gaba da irin wannan, to abubuwan da suke faruwa a waɗansu ƙasashe da muke ji Allah ya kiyaye yana iya zuwa nan. Wannan cutan ba za ta tafi don kanta ba, sai mun yi abin da zai sa ta tafi. Abin kuwa shine ci gaba da bin ƙa'idojin da aka gindaya. Maganan wanke hannu akai-akai, da rashin taɓa fuskan kan hannuwanka ba kyau. Maganan ba da wannan tazara da ake magana, da dukkan sauran abubuwa. In ma ba ka da abin da za ka yi, kar ka fita zuwa ko'ina, kai zaman ka a gida. Wannan koronan tana tare da mu yanzu, kuma zuwa nan da wani tsawon lokaci ya zama wajibi mu koyi zama tare da ita. Dama an ce sanin halin mutum maganin zama da shi. In mun san yadda take yi ta kama mutane, to sai mu guji yanda abubuwan da za mu yi ta kama mu. Kamar yadda aka yi bayani, a ce yau mutum ya kama da cutar corona ba abin kunya ba ne. Abun kunyan shine ka ji alaman ka kamu ka ki zuwa asibiti ko ka ki zuwa a gwada ka, ka je ka sa ma waɗansu ko da gangan ko cikin kure in dai har ka ji alaman kana da ita. To jama'a mu sani cewa duk wani abu da za mu yi a yanzu dole mu yi shi da sanin wannan cutar tana nan. Dole mu canza yanda muke rayuwa ba kaman baya ba. Da gwamnatin ƙasa da gwamnatin jihohi suna duk abin da za su yi su taimaka. Me wannan takunkumin yake kare maka da baka son sawa? Iyakacin kare lafiyarka. Saboda haka an ce in kunni ya ji gangan jiki ya tsira. Akwai matsala idan ba mu bi ƙa'idojin nan ba. Kamar yadda muka gani cutar na ƙaruwa ne kullum. In mun duba daga 400 a cikin wata 3 kacal, yau muna 20,000 da wani abu. To jama'a, ga mu ga corona, wa muke so mu ga yayi nasara? Mu, amma fa sai mun tsaya tsayin daka, mun bi ƙa'idoji, mun bi dokoki. Muna ganin dai abin da yake faruwa a sauran jihohi, a sauran ƙasashe na duniya. Mu gode ma Allah da kuma yanda gwamnati tashin farko ta yi sauri da azama ta kafa wannan kwamiti da kuma duk matakan da aka ɗauka. Yanzu ya rage namu, nauyi ya dawo wuyan kowa da ya yi ƙoƙari ya kare kanshi domin kare waɗansu. A je a gwada. In ka ji rashin lafiya, zazzaɓi, a ciwon kai, a ciwon makogaro da duk sauransu alamun koronan nan ana ta faɗe. Da zaran ka ji, ka keɓe kanka, ka je gurin gwaji. Ta haka ne fa za mu taimaki juna don saboda mu kau da wannan cuta daga nan. In ƙara jaddadawa a ƙarshe, tana nan ba ta tafi ba. A ci gaba da sa wannan takunkumin, a ci gaba da wanke hannu, a ci gaba da ba da wannan tazara. Duk waɗannan abubuwan za su taimake mu in Allah ya yarda. Mu kwana lafiya.
Thank you very much, Honorable Minister of Environment. That brings us to the question session. If we're ready, we'll take your questions now. If you are watching from home, you can send your WhatsApp question to 07053536666. Your comments or your questions. If we cannot take it today, we'll factor them into our responses later. We'll take
frontline workers like drivers who convey COVID-19 patients to the isolation centers. Now, the crux of their agitation is that they have not been paid their inducement and hazard allowance since they started working. That they were only paid in March. That of April and May have not been paid. That is their daily allowance of 20,000 naira. Now, when they started, they were camped in a hotel. Because of the nature of COVID-19, how dangerous it is, they do not want them to go back home and infect their families. But as we speak, they have been injected, they have been kicked out of the hotel as we speak. And this is coming at a time where we are yet to meet our target of testing 2 million people in 3 months. I want to know why these people have not been paid. And there were also some people who also met me, and they have the same agitation. I think they are the port health workers. They also have the same agitation, so I want you to react to this. And the second question is still to you, Minister of Health. I was listening to a radio program last week, And the guest that was brought on one of the programs, which is I think he's the chairman of the medical subcommittee on COVID-19 in the FCT. And he said, he made a claim that for every patient, for every COVID-19 patient in the isolation center in the FCT, the federal government is spending 1.7 million naira to treat that COVID-19 patient. whoever has spent 14 days in isolation. So I want to know how true this is. And finally, to Mr. Chairman, well, last week, the PTF marked 3 months since its inception by President Muhammadu Buhari. Of course, we know that these 3 months, yes, increased testing, but we cannot shy away from saying that these 3 months, we've also had so many cases that have arisen from COVID-19. A lot of Nigerians also flouting some of the guidelines as stipulated by health experts, interstate movement, same thing. I want to know, in the 3 months that is coming, I want to know what strategy that you'll be coming up with that will change some of these narratives. Thank you.
The Chairman, National Coordinator, Honorable Ministers, DG, and members of the task force, my colleagues. My name is Amaka Ode. I report for Arise News. My first question actually goes to the Minister of Health. Well, some medical experts are claiming that our fatality that we're seeing these days is actually related to the home care, which you have told us that as it stands right now, we have about 80% of our confirmed cases being treated at home. They are saying that these people who are isolating at home are not checked, and also they are not getting the kind of medication they need. So I need to hear from you. Walk us through the process involved in home isolation. How many times are these people being checked, and what sort of treatment are they being given, and by who? And the next question actually is for the DG of the NCDC. Well, sir, from last week, we've seen some states come out to claim that they've been able to discharge all their confirmed cases from the isolation centers, and they have no more cases. So I want to get from the NCDC, how many states in Nigeria are COVID-19 free, aside from Cross River that your record is still showing? And the next question is for the Honorable Minister of Humanitarian Affairs. Well, NPAR beneficiaries, they have reached out to me a couple of times. They said they haven't been paid their money for the past 3 months, and they want to know why and when they will be paid. And finally, to the chairman, as well as the national coordinator, any one of you can take this up. Well, Nigerians want to know, with all the funds that you have in your coffers, how much are you dedicating to homegrown solutions to COVID-19? Thank you.
Good evening, Chairman and members of the Presidential Task Force, my colleagues, and Nigerians at home. My name is Mitaire Ikwen. I report for the Nigerian Television Authority. My first question is for the DG of the NCDC. Some Nigerians want to know how you can relate the result for the gene expert machine initially configured to test for tuberculosis, which is a bacterial infection, to conclude for the presence of coronavirus, which is a viral infection. And for the Minister of Health, the PTF keeps advising anyone with COVID-19 symptoms like coughing, sneezing, and headache, as the case may be, to present themselves for testing. Now, with the peculiarities of the wet season, a plethora of these symptoms, people come up with a lot of these symptoms. Now, if everyone with such symptoms present themselves for testing, do we have the capacity to test and isolate them all? And for the chairman of the PTF, a lot of audiovisual materials have been circulating on social media, alluding to conspiracy theories and also encouraging skepticism about the pandemic. In fact, over the weekend, one of them that was trending, even up till now, is that of a Ghanaian that was reading a script that was talking about the timeline of the pandemic. And there's the tendency to believe such script because of what has played out so far and what is likely to play out. And I'm asking, what is the reaction of the PTF to such materials, considering the fact that they could impact negatively on risk communication and believability of the pandemic? Thank you.
Good evening all. Rachel Abuja from the News Agency of Nigeria, and my first question is to the coordinator. Sir, most states and the FG have eased down lockdown, and we're experiencing a spike, obviously, in the country. Aside of the possibility of another lockdown, what are the other options open that the government will be looking at? Meanwhile, we've all said a lot about masks. And I want to relate not just all Nigerians having masks, but let's relate it to the effectiveness of wearing a mask. So let's apply science to it. I don't know if we are looking at having like some sort of programs, maybe a long program using every medium for Nigerians to understand the effectiveness of wearing a mask or having a mask, because we are all guilty of it as it is now. My next question is to the DG NCDC. Welcome back, sir. You did not tell us that the 4 states had any challenges. I'm surprised. So how effective has the contact tracing been in helping to develop the response so far? I would like to know. Meanwhile, our fatality rate in the country remains 2.6 to 3%, which the numbers of confirmed cases keep increasing. Does this mean that we are doing good, or we are not reporting all cases? I don't know. I would like to know. Sir, I would like you to answer this question, please. I would like to know if there's anything you're doing to reduce our turnaround time for COVID-19 tests from maybe to 6 or 12 or against the 48 hours. This would do us a great deal because of for health, facilities to attend to critical ill patients in the country. More so, I would like to know how many sample collections we have in the country as of today, because there have been a lot of complaints during the weekend, and the total number, they've not been going through, and even when they go, people keep waiting, and at the end of the day, they don't get to see NCDC in their state or their locality. Many thanks.
My name is Hassan Umar Farouk. I report for Liberty Radio and Television. The first is commendations, sir. Mr. Chairman, coronavirus pandemic is a test of leadership. You and your team are doing good. This is from a patriotic Nigerian. Minister of Aviation, Minister of Environment, sir, any update from the ongoing nationwide fumigation in Hausa, sir? Ba maganan cewa mutane suke ba wai cewa an sassauta wannan doka. Har yanzu fa akwai mutanen da ba su yadda ba akwai wannan cuta ba. Dalilin su shine ba su taba ganin wanda yake halin rabbana atina an nuna shi a TV. Mu muna sauraron wannan mutane kullum muna yin programs a TV da radio suna ga mana cewa su har yanzu fa ba wanda aka nuna kamar yadda suke gani a kasashen duniya. Me za ka ƙara game da musamman a arewacin ƙasar na yadda mutane ke ci gaba da samun ɗar da kuma shakku cewa wannan cuta akwai ta ko babu ita? Minister of Aviation, sir, there is this fear from Nigerians that if flights eventually resumes, that they are going to pay double. They are going to pay for those empty seats. They are meant for social distancing in this flight. How true is this assertion, sir? Akwai tsoro da cewa in Najeriya duk lokacin da aka dawo harkar zirga-zirgar jiragen sama, da girma minista 'yan Najeriya za su biya kuɗin tikitin jirgin sama da ɗan karen tsada. Ya lafiyar giwa bare ta yi zazzabi a cikin wannan lokaci a ce za a yi haka. Menene gaskiyar wannan tunani na 'yan Najeriya? Thank you very much, sir.
Good evening, the SGF, honorable ministers, my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My first question goes to the SGF. So the National Petroleum Investment Management Service says that the federal government has given it approval to reduce 40% of its workers because of the effect of COVID-19. This was confirmed when the affected workers met with some media organizations, and the management of NAPIMS also confirmed that. I want to know how true this is. Secondly, my question is for the Minister of Foreign Affairs. Over the weekend, we saw the demolition of the Nigeria's High Commission in Ghana. Beyond the condemnation, the letters or whatever, what again or what else are you doing or the government is doing to ensure that this does not happen again? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Baloyen of the Sun newspapers. Minister of Education, sir, this is for you from a concerned parent. He said the same day that PTF advised schools should not resume was the same day that Oyo State government released resumption date. And he said on that same week, a report of 100 index case was recorded in one day in Oyo. He wants to know what your ministry is doing to convince the governor of Oyo State to halt resumption date. This one is for you, Minister of Health. Despite assurances from the PTF, some Nigerians still don't believe that there is any collaboration going on between the ministry, NCDC, and some primary health centers. So they want to know if you can give us a list of these centers you are collaborating with. Thank you.
Good evening, all. Abbas Adebawale Juma is my name from Daily Trust. The first question is for the NCDC DG. The Kano and Lagos State government announced that they will authorize home treatment for those who have tested positive to the COVID-19. So Nigerians want to know if you sanctioned that for them or there is another variation you want them to apply. The second question is for the chairman, sir. The national coordinator just mentioned it now that Nigerians still don't believe in the COVID-19. It's only when they go to the security designated centers that they pull the face mask from their pockets or their bags. And there are messages sent to our offices that the way they are seeing this happening to other countries, including the Brazil that you mentioned, they didn't have any feeling of it happening in Nigeria. So they are now requesting if there can be some kind of guided reportage of the various treatment centers so that Nigeria can see it that is happening to their own citizens. And they said that you should not wait to hear that fellow Nigerians are attacking those who are using the face mask as saboteurs. Then the last question is for the national coordinator, sir. Then they said that you announced if the airlines are ready, the airways can be open on June 21, last Sunday. And as this did not happen, so they were now asking if the reopening of the interstate roads are linked to the reopening of the opening of the airports and the Nigerian Airways. They wanted to know when you are going to allow them to move despite the rising in the cases. Thank you very much.
Thank you. That closes the question session. We'll be taking responses from the Honorable Minister of Health.
I think we'll start with Amaka's question. You asked some states were discharging patients and declaring themselves COVID-19 free. No state, no single state in Nigeria is COVID-19 free. Not one. No country in the world is COVID-19 free. Even New Zealand, there's an island state, is still having new cases after a period of not having any. We can't separate ourselves from the rest of the country. We live in a context. Viruses spread. It's the nature of them. So right now, no state is COVID-19 free. That's why we have to keep doing this work that we're doing, testing people, finding out if they have it. Even if you don't have it, you can spread it. So even if you're asymptomatic, you live with others that are more vulnerable, that can get very ill if you get it. And that's the responsibility that we all have. And that's why prevention is very important. If you can't prevent, you detect. And it is that detection that we call lab testing. And that's why we have to scale our lab testing. So even if some of us are lucky and get away with having asymptomatic infections, we have to test more. So really, we can only start thinking and talking about any state, any community being disease-free when we have an effective tool to fight that disease. That will come when we have a vaccine. Until then, there's no easy way to say this. We have to keep pushing on these preventive measures. We have to develop our laboratory capacity to test. And either you start testing now or you start testing later. But eventually we will all test. That's for sure. Mitare, your question was on TB and COVID and why we're using the same equipment, GeneXpert, for both. GeneXpert is just a modern way of doing PCR testing. It's a new way. We had TB as a problem. You combine it into a cartridge, and you plug that cartridge into a GeneXpert machine. It avoids the long processing time and gives you a result. So it's a very cute way to develop of expediting that PCR process. That has now been adapted for COVID-19, but the cartridges are different. So the cartridges you use for TB are different from what you use for HIV, which is what we've been waiting for. We had the GeneXpert equipment for a long time. What we didn't have was the cartridges for COVID-19. So it's fairly straightforward, and it's a beautiful technology for lab people. It avoids all the difficult dilution that you need to do when you're doing conventional PCR. The problem is you can't do too many samples at a time. So it's easier, it's closer to patients, but it can't process the volumes that we can with the conventional methods. Rachel, I think you had 3 questions. You said I didn't speak about challenges sorry, at the state level. Where are you? Okay, there, yes. We didn't speak about challenges there were lots of challenges at the states. Our responsibility when we go to states is to have a robust conversation with the states in their states, point out their challenges, but really it doesn't do us any service to come out and talk about challenges. We identified a few challenges, but on the average, these 3 states, and including Lagos, of course, we've talked about several, are actually doing well. And we learned a lot from them that we now want to take to other states to show. And that's really the value of going to these states, to share information, to understand what they're doing, gaps and learning opportunities. We have 37 states in Nigeria, different levels of resources, different challenges, different contexts that they work in. Your other question was on turnaround time. If you look at the turnaround time, they have really gone down in many places. In many places in Abuja, you get your result in 24 hours, sometimes a day and a half, generally. The testing itself takes 8 to 10 hours, but you remember it takes some time to get the samples to the lab and get the results to the state. Now, at the moment, it's very difficult to reduce the testing period to more than 7 hours for conventional and more than 3 hours for GeneXpert, right? The technology just doesn't allow that yet. And that's why we're all looking for a rapid diagnostic test kit that works. We've assessed a few. The Medical Laboratory Council of Nigeria has done a few assessments. None of them have worked sufficiently yet. But we'll keep trying. Efforts are going on around the world. I don't come out here to tell you these are the 3, but there are many efforts. Every country is looking for the same thing. So once we get one that works sufficiently, this will really change the landscape of the work that we do. And I know that a lot of hospitals is very frustrating for many people because of sometimes there's anxiety about treating people until you know their status. These are challenges every country in the world is facing. But our short-term strategy is to ensure access to the tests that we have. And that's why we're rolling out GeneXpert very aggressively. In the next week or so, we'll be able to say that there's access to testing in every state in Nigeria that wants to. We're nearly there. I think there are about 6, 7 states that don't have a testing facility yet. There are some that are in progress. They're mostly using the GeneXpert technology. So by next week, we will say that the country is covered. So the challenge will be, of course, some states are big. To get from one end to the other takes a while. So that will be the next challenge. But the first thing is to make sure we have testing capabilities in every state in Nigeria. Your last question was on sample collection. This is really a state responsibility. I can't tell you the number of sample collection points in every state because states organize this differently. But I was very impressed in Edo, for instance. They have collection centers around the state. Akwa Ibom is working very hard to do the same. So I really saw a lot of innovative approaches. Lagos already had decentralized their response a few months ago. So I think that's it. Abbas had a question, but the Honorable Minister of Health has answered that in terms of home care. And also the Honorable Minister of Health has really been working very hard to engage all the states, their governors in Nigeria, to really get us to work together as a country. These are not easy things. We run a federation, so every governor has a lot of autonomy, but at the same time, we're trying very hard to work together to get the best solutions for our country. Obviously, the viruses don't know whether we're a federation or not. They don't understand the political structures, they don't understand the borders, they don't understand the PTF. All they know is, let me find the next person I can infect. So we have to understand that the forces that we are fighting are not conventional in nature, and we have to work together to address those challenges. So thank you very much. Which one? Okay, so thank you. There are 2 technical questions. On contact tracing, 12% of all our cases right now have been found through contact tracing. It used to be a lot more. But once you have widespread community transmission, it becomes a lot more difficult to identify where you got that infection from, right? So in the early days of the outbreak, I think we had 40 to 50% of all cases were found through contact tracing. That's a cumulative number, so it keeps decreasing as we have more infections, especially because most of our cases are coming from Lagos. There's widespread community transmission. So even though we're doing contact tracing, it's very difficult to identify who you got the infection from because so many people have it. So that's really the benefit. But we keep doing it. And in states where there are fewer cases, then a lot more effort is made to find where you got it from because the capacity to do it is greater when the numbers are fewer. On your question on the case fatality ratio, you see, the first thing to say is that we're happy that we're not seeing as many deaths as many other countries in the world, right? So it's somehow gratifying. And yes, we've seen a few clusters of deaths in Kano that have been investigated, and everywhere there's a cluster. In public health, death is the worst outcome. It's also the most difficult outcome to hide because there's no gray area on whether you're alive or dead. So we do our best to find all the cases where so far we seem not to have a high case fatality ratio. In fact, many countries in Africa are seeing the same things. In fact, our case fatality ratio is higher than in Ghana, higher than in South Africa, despite being still relatively low in a global context. So I think that's also a good point for our clinicians that have been working very hard to save lives. We've really stocked up on oxygen concentrators and ventilators. A lot of the ventilators that we bought, procured and got, are not being used maximally, thankfully. But we have them in stock and being distributed to the states. So this is an important number to watch. And we're spending a lot of effort to make sure we watch that case fatality ratio and make sure we keep it as low as possible. Thank you.
So I think I have a few questions. Two of the questions are fairly similar. What's the strategy in the next 3 months in terms of arresting the rising number of cases? And there was a similar question that talked about the other options apart from lockdown. So first of all, I wanted to say that it's not our strategy, it's a collective strategy. Over the last 3 months, the steps that have been taken to arrest COVID-19, there wasn't a major problem with those steps. The main issue with those steps, with those guidelines, is the lack of effective compliance across the board. What do we intend to do over the next 3 months? We will continue to do what we have done in the last 3 months, which is really pushing for increased testing, trying to isolate people as they come up positive, making sure that we have increased public awareness and engagement. Because this is about risk perception. Behavioral change is the only thing that can stop the pandemic. This is a virus that jumps from one person to the other. Understanding how the virus works, understanding how the transmission happens is the only way that we can continue to convince people to change their behavior. We will continue to work with traditional rulers and community leaders. We'll continue to push for more and more testing and more engagement by the leaders, because generally speaking, the public usually look at the body language of their leaders. If at the state level it's very clear that the states do not take COVID to be a major health problem, then what do you expect from the public? They are very likely to take that lax attitude as well. And what we do not want is a situation where it's only at a very late stage that we realize the severity of the COVID-19 pandemic in our country, or even in some states. We'll also be pushing towards hotspot targeting. This is looking at specific local governments that have a very high prevalence of COVID infection. We are already working, so FCT, for instance, and Kano have done some house-to-house household testing. We'll also be looking at that. We'll be looking at the provision of palliatives linked to increased testing and isolation of members within communities, and also working to try and reduce the issue of stigma and discrimination, because this is one of the key things that's currently challenging our ability to increase testing. But overall, I would say that every option is on the table. We cannot exclude anything. Some of the deaths that we are seeing now reflect the numbers we had 2-3 weeks ago. And the numbers we currently have now are a lot higher. And what we want to do is to make sure that we continue to improve the case management side as well, even though a lot of our patients at the moment do not require ventilation. But what we do know is that some of them are presenting very late. Some of them are presenting when they need oxygen, when they have become extremely unwell and are dying. So we are putting a lot of effort into improving the security of oxygen supply and administration across our hospitals. Yesterday, over the weekend, we had 545 oxygen concentrators that were delivered through the UN single basket. And this is all part of it. So a lot of work going on, but the key thing is behavioral change. This is the new normal. For us to get on top of the COVID pandemic, we have to change the way we behave. We have to change the way we interact with each other. We have to abide by those rules, those guidelines that may be inconvenient but could potentially be life-saving. The other question had to do with funds for homegrown solutions. So within the PTF, we do have Sustainability Subcommittee, which is linked to the Federal Ministry of Trade and Industry. We've already been working very closely with them to identify local solutions in terms of manufacturing of PPEs, etc. We already have a list of companies that potentially can be used to procure PPEs that have passed through the normal standard organization SON validation process, and we have forwarded this list to our donors as well as our partners. But from the point of view of academic institutions, it's important to remember that PTF is not a research body. This is a start and finish task group. What we can do is to facilitate the development of grants and grant proposals for future research. We cannot fund randomized clinical trials or research. That's not really our mandate per se. We'll continue to work with the members of the academic community to point them in the right direction. We frequently get requests or samples from people that claim to have cures for COVID. I'm afraid the PTF is not the place to go. People should know where to go for where they have claims. It needs to go through the normal validation process through the Federal Ministry of Health. Then the last thing has to do with airports opening on the 21st of June. Can we have the interstate roads open as well? Or, well, we still have restrictions on interstate travel. There's no doubt. Yes, we cannot open flights between states and keep the roads closed. But it's not the same vice versa. In other words, we cannot, just because we've said flights can open on the 21st and they haven't, we need to open the roads. No. At the moment, we still have restrictions in terms of interstate travel, but we have been linking up with the Federal Ministry of Transport through the Honorable Minister of State Transport. They've given us guidelines that they have developed, very detailed guidelines that we have looked at, summarized and discussed at PTF last week. And we've asked the Honorable Minister of State to please engage with the road transport workers and owners to make sure that the parks, the usual garages and parks that we have are ready. They are COVID-19 friendly. Well, maybe friendly is not the right word, but they are ready in terms of the guidelines that we have in place, such as physical distancing, reducing the number of passengers per vehicle, and the provision of hand washing facilities, etc. And I believe they are already working on this, and hopefully we should be able to open as soon as we know that it is safe to do so. Thank you.
Oh, yes.
So there's no doubt it's important to have, the media is very important in terms of pushing through messages that have to do with wearing masks and the effectiveness of wearing masks. I believe we do have I'm pretty sure I have seen programs on TV where it talks about reducing the amount of droplet transmission if we wear a mask versus if you don't. But yes, it's a good point, and it's something that we'll continue to look at. Thank you.
Good evening, everybody. There's actually just one question, but I've just been told that there are a myriad of others that have come through the social media and the network. And I've been trying to look at all of those. But primarily, what has been asked here is what Oyo State did. The Ministry of Education did not give any guidance to Oyo State to reopen schools. We also think that that is a little bit contradictory, because if you look next to them is Ogun State, that actually had a lockdown. So there is no reason why there should be more numbers in Oyo State than there are in Ogun State, where we thought we had a problem. So something is not okay in that respect. However, Oyo State, like all other subnationals, have governors. And under our constitution, governors are responsible for their states. You may have heard from our interaction with you constantly that there are, out of the 774 local governments in Nigeria, there are actually few local governments with a lot of this burden. And therefore, it is easy to get a perception around the edges of the country that some things are not happening because it's not happening within your immediate locality. But you must appreciate that the primary purpose of government is the security of its citizens. Security is not only when people start shooting guns at you. Healthcare, public health is key and primary in that primary security delivery. And that is why we are almost extremely cautious in making any pronouncement around this. Because the education sector owns the largest number of infrastructure in the country. We own 138,000 primary schools around the country. So if you just reopen that alone, there are nearly 600 all kinds of institutions awarding certificates around Nigeria. School of fishery, school of anything you can think, school of nursing, any type of education in Nigeria. There's just a lot of it. And at every given time in Nigeria, there are nearly 30 million people attending one form of formal education or the other. That's about the largest in sub-Saharan Africa. For you to even begin to decide to unroll and unleash this in the public in the face of a pandemic is to be, at the very least, insensitive. Nigeria hasn't gotten to optimal testing, so we cannot even forecast or hazard where this epidemic or pandemic is most positioned at. So the least we can do at the moment is to keep our children, our most prized assets, the future of Nigeria, under lock and key first. When we are sure that it's safe to release them, gladly, we will. But there are questions that have also come through. One is about, from Anambra State, somebody said, so if COVID is around for 5 years, we will shut down everywhere for 5 years? My own is that we open churches specifically for this purpose. Go and pray that it's not around for 5 years. It is important that we understand that what government is doing is taking the advice of scientists and the data that they provide in making decisions. I'm not sure schools will be closed for 5 years, and I'm not sure whether this will be around for 5 years. But as we learn more, we will take decisions that are in tandem with what we have learned. It is in that respect I'll answer the next question, which is, what do we do with WAEC and NAPTEB and NECO? I've appealed to parents. Ours is a social ministry, and our job relates to families and homes. I've appealed to mothers and fathers consistently. Please bear with us. Continue to manage our children for us. You are our helpers in this regard. If there is anything we can do to help you, we will. My sister, the Minister of Humanitarian Affairs, has even gone the extra length of taking food to homes so that we can make this happen. She's continuing with that effort. It takes a lot to go through this register and isolate, whatever, in any way we can assist. We've tried to teach, give online, anything that we can approach with. Every day we are open in the office. All our teachers, all our people are concerned. When you say the education sector opened, you're opening transporters, drivers who will take people to school, those who will cook for the students, those who will sell puff-puff, buns. All these people are interwoven in our system. The teachers need to go home from when they finish teaching your children. They need to be able to come back the next day. What happens if a teacher falls ill? For instance, who will take over his or her lesson? if she takes it home to her own children, the country cannot afford just to say, because we are tired, we should then deal with the schools like that. So I go back appealing to parents. You are our last defense. The chairman has explained that before you were the last one, now you are the primary defense. Before we get to doctors, we don't want any of our children arriving at doctors' clinics at all. We want parents to please hold them. Do your best. Whatever it is we can do, we will help. Somebody has also asked about salary of teachers in private institutions. I can't really tell them what to do, but I've advised a couple of private institutions to approach the CBN under the scheme of what they call the medium scale so enterprises. Some schools can't afford to shed teachers, but you can have salary support loans, which you can use to manage and tide over the period until you start earning revenue. Most parents do not want to begin to pay you third-term fees. For schools, their children are not attending. The children are eating ×2 what they are eating before at home. Their mothers have to return early to take care of them. Now you're telling parents to also pay for something that is not happening. I'm pleading with you, fellow Nigerians. It's our job to help you and assist you. If you go and apply for these short-term bridging facilities within the context of your small-scale enterprise, I'm sure you'll find accommodation, especially when it relates to augmentation of teacher salaries and with a repayment plan as you go ahead. Then on examination dates, yes, we have finished meeting with WAEC. They are communicating in Gambia at the moment. When we get a feedback from them, we are struggling to find how we can bring the exit year children briefly to come to a revision session ahead of whenever these assemblies are agreed. Parents should be rest assured that we will do this with utmost care, and only in places where we can institutionalize and be able to use the facilities to be able to help these children. Thank you very much.
Distinguished ladies and gentlemen, good evening. The question is on N-Power, why they were not paid for 3 months. As far as the ministry is concerned, we have paid N-Power beneficiaries that have been verified and recommended for payment. We have 500,000 N-Power volunteers. But for those who are claiming that they've not been paid, we are looking into these issues together with the Office of the Accountant General of the Federation. I mentioned on this platform that we've had issues around migrating from the platform that we used to operate with to the Chief Minister's platform. So these are the administrative processes that have hindered some of these volunteers that are claiming they have not been paid. There are about 12,000 of them based on our record. As I'm speaking to you, my permanent secretary is in the Office of the Accountant General to sort out these issues. And once we get the report, we will make it available to all. Thank you very much.
Tambaya ne akan waɗansu da ba su ma yadda akwai wannan COVID ɗin ba, da kuma maganan ilmantarwa. So the question is on those that do not believe, maybe we need some extra education. Okay, let's start with educating people. Again, I'm reverting to Hausa. har a yanzu muna da malaman kula da lafiyar muhalli waɗanda suna nan a ƙananan hukumomi da kuma ɓangaren jihohi suna ci gaba da ilmantar da mutane akan cewa akwai wannan cuta, kuma abin da ya kamata ka yi ka kiyaye don kada ka ɗauki wannan cuta bare kai ka wahala kuma ka je ka yaɗa ma waɗansu. Muna ci gaba da yin wannan. A ta nan ɓangaren ma abin da zan ƙara kira shine akan shugabannin addinai su taimaka wajen ilmantar da mutane akwai cutar nan kwarai da gaske, da kuma ƙungiyoyi masu zaman kansu su ma muna kira da su sa hannu wajen taimakawa su ilmantar da mutane, da ƙungiyoyin matasa su ma su shiga cikin wannan al'amari na ilmantar da mutane. To mu zo kan waɗanda wai ba su yadda ba cewa akwai ta. To matsalan irin wannan shine kaga mutane na mutuwa, kaga mutane suna cikin wahala, suna cikin halin ha'ula'i, ka ce baka yadda ba. To matsalan shine Allah ya kiyaye, kila a lokacin da mutum zai yadda kuma lokacin ma ba zai san ya yadda ba domin babu shi. Jama'a ina so ku sani cutar corona akwai ta, mun gani. Inda ana ganin babu, ana jin labarai a ƙasan turai a ina ne, mun gani a nan. To haka kawai kuma sai mutane su zauna su rinka gandara ƙarya cewa akwai cutar da babu ita, da wani dalili? Saboda haka masu cewa su ba su yarda ba, to mu Allah na tuba inda a kansu za ta tsaya ba za su samu wani ba, sai su jira lokacin yaddan da ba za su iya yadda ba. To Allah ya kiyaye, cuta akwai ta, tana nan. Abinda muke gudu shine dai sa ma waɗansu da su suka yarda akwai, idan wani bai yarda cewa akwai ba. Akwai cuta jama'a, a kuma ci gaba da ƙoƙarin kare kai, shikenan.
Gentlemen of the press, the question is both in English and in Hausa, and whether as we open the air industry, airfare will skyrocket and become impossible to fly. Well, that may not necessarily be the case, because as I speak to you, day in, day out, we've been meeting with stakeholders of the industry to find out how best can we open this industry up in such a way that it does not bring hardship to the airline industry in general, not necessarily only the aircraft itself and the contents of the aircraft, that is the passenger, also other airport users, because definitely physical distancing will come into effect in the airport itself. Airports, having been known to not necessarily be only centers of landing and taking off of aircraft, they are centers of huge economic activity and social activity. They have become cities now, or another word for it is aerotropolis. And so the happenings around airports certainly is putting people together and getting them to socially interact and do businesses and create huge economic activity. So we're doing all of that, and we're coming with the measures to cushion and reduce that effect. And whether that will affect the propensity to fly, I think that's the whole purpose of us interacting with the industry to come out to ensure that passengers are encouraged to fly, because the huge significance of air transportation cannot be underscored. It's an industry where has huge economic advantage and contribution to national GDP. So yes, we are doing everything to ensure that ticket prices have not skyrocketed. They may be different, but they are not going to be something that passengers would not afford. So in Hausa, mai tambaya ya tambaya ne akan wai farashin tikitin jirgin sama na cikin ƙasa da na waje, ko idan mun buɗe tashoshinmu za mu ƙara kuɗi ne, tunda ana ganin kamar cewa in an ce lalle a zaman guda da buzuzu a cikin jirgi sai wasu kujerun kila an wato ɗauke su ko kuma an kashe su don a bada wannan tazara tsakanin juna. To shine nake bayanin cewa ita tashar jirgin sama ta tashi daga yadda aka santa na al'ada, cewa tasha ce inda jirgi ya sauka ya tashi akan daɓe kuma mutane su ɗauki kayan su tafi gida. Ta koma wata babbar cibiyar kasuwanci da mu'amala da cuɗanya da tarayya ta al'umma, yin abubuwa daban-daban waɗanda suke amfana tattalin arzikin ƙasa. To ba kawai za mu kalli fasinja bane shi kaɗai, za mu kalli duk mai amfani da tashar jirgin sama ne. To shi ne ya sanya muke ta wato tattaunawa tsakaninmu da waɗanda ke da ruwa da tsaki a wannan harka ta sufurin jiragen sama, mu gano waɗanda dabaru za mu hiddo mu sanya su a gaba yadda za a samu sauƙi, yadda cewa wato farashin tikiti ba zai tashin goron zabo ba zai haramta ma mutane ba, saboda kallon amfanin sufurin jirgin sama a tattalin arziki da kasuwanci da cuɗanya da al'umma. Saboda haka dabarun suna da yawa. Akwai sulke misali da ake tsammanin za a fasinja zai iya sanyawa, yadda in ka tsaya kusa da shi ba za ka ɗauki wannan cuta ba, saboda cuta ce wadda sai ka yi tari ko ka yi atishawa fartsatsin ya sauka a wani wuri, ka taba hanci ko ka taba baki sannan ka kama. To za a ci gaba da yin abubuwan da aka saba na tsaro na wannan cuta, misali goge wuraren da ake tattabawa, hannun kofa ne, teburi ne, taga ce, garu ne da makamantansu. To duk za a ga ana yin wannan abubuwa a tashar jiragen sama. Saboda haka ina tabbatar ma al'umma cewa lallai ne lokacin da za mu dawo, mu ma muna son lallai mutane su amfani da waɗannan kafafe na sufurin jiragen sama domin ci gaban ƙasarmu baki ɗaya. Saboda haka za mu hiddo dabaru wanda su tabbatar da cewa ba a wahala ba. In English, I missed just one important component talking about that. It's called Sirke in Hausa. There are a lot of devices now coming out that we would introduce into air transportation. Example of them is that reversing the chairs to face opposite and put a capsule over and above a passenger, for example. Because knowing this guy, that he's a droplet, that you must cough him or sneeze him and he drops on a surface and you touch your face and then you get it. So if that is the case, then we're coming up with all how to clean surfaces, to disinfect them or decontaminate them, to heighten that, within the aircraft itself and within the surfaces around the airport, and so on and so forth. And by the way, just to announce that perhaps on Saturday, this Saturday coming, we would make a demonstration to demonstrate and do a dry run of Lagos Airport to see how things would look like. And we're using this medium to invite all of you, gentlemen of the press, to be there and see it firsthand and then help us, It will be in Lagos for many reasons. Your colleagues in Lagos could do it. I think it's one press, and that's why we call you gentlemen of the press, don't we? So in Hausa, saboda wannan ne ya sanya muka ce to tashar mu ta jirgin sama ta Iko za mu je can mu yi wato gwaji na yadda al'amura za su kasance idan an dawo da wannan sufurin jiragen sama, don mu nuna ma al'umma yadda za a yi, inda za ka tsaya, yadda za a yi abubuwa, mu gani cewa idan mun taso an yi wannan abin cikin lumana kuma an samu nasara. Assalamu alaikum. Thank you very much indeed.
Good evening, ladies and gentlemen of the media. The question is obviously not COVID-related or PTF-related, but I'll take it nevertheless. It concerns the attack on the premises of the Nigerian High Commission in Accra, Ghana, over the weekend. And the question was specifically what we've been doing about it. Well, of course, we registered a strong condemnation of the attack, which was clearly unjustified. And, furthermore, under the Vienna Convention that regulates relations between diplomatic relations between countries, this was a clear violation of the principles of the Vienna Convention. Now, what we can say is that it was a non-state actor that was involved. I mean, it was not the government, and it was not government sanctioned. We've engaged with the highest level of authorities in Ghana. The foreign minister went today with the officials of the Nigerian High Commission to the land registry, because it appears that there are some people who are claiming that they have a legitimate title over that piece of land. And the message I received directly from the Minister of Foreign Affairs of Ghana was that everything will be sought out, will be settled, that the President had directed for very severe action to be taken against those who were responsible for that, including, if necessary, immediate arrest, and that they will be coming out with a definitive statement. So we have to wait to hear officially and formally from the government of Ghana. The ball is in their court now. We've registered our complaint. They have acknowledged and apologized for what happened, that it should never have happened. And so we want to get a full report before we can make a definitive statement. And we hope to receive that tonight, so to know what the legal status was. And also importantly, what the government of Ghana now intends to do in terms of redress and such like. So we'll wait. It's a moving, evolving story, and I will keep the country informed as we go forward and unravel this most unfortunate incident. Thank you very much.
Thank you, Minister of Foreign Affairs. We now invite the chairman of the PTF to the podium, the SGF.
I think my colleagues have dealt with invariably all the questions. But let me see a couple that I would attempt to deal with before I summarize for the day. How much is committed to research and homegrown cure? Amaka, you did ask that question to me and the national coordinator. I think this is one public health challenge that has received all the attention that it deserves. Traditionally, in the budget lines of all the research institutions, every year there are monies allocated for research development inventions in the different ministries, whether it's Ministry of Health, which has a couple of agencies that deal with research matters, or the Ministry of Science and Technology. But in addition to this, for the purposes of addressing COVID-19, Central Bank has set up a grant facility that any researcher or developer can access to the maximum of 50 million naira per application. You can access that, and they've even gone further to constitute a body of experts with NAFDAC chairing, with representatives of the Federal Ministry of Health, Nigerian Center for Disease Control, and the National Institute of Medical Research also has a representative. The Nigerian Institute of Pharmaceutical Research and Development also have a representative in that committee with 2 independent industry specialists for the purposes of appraising applications that would qualify for these grants. And I've been reliably informed that they have received several applications from the private sector and from the university communities, those desiring to access this particular grant that has been set aside by the Central Bank. And I think under the Federal Ministry of Education too, I stand to be corrected, the TEDFON research grant is already out. I saw a publication with respect of that. So all our researchers, all our inventors should access these resources for the purposes of advancing the course of their research work and inventions by receiving these grants that have been made available. Oftentimes, government will create a facility and you find out that at the end of the day, not very many people access it. Not many people access it, not as a result of government's inability to create those facilities. Those facilities have already been created. If you go to the website of the Central Bank, you will find that information. If you go to the website of TEDFON, you will find that information. But I don't know whether we want to be spoon-fed on every occasion. But for this, I think every serious researcher and developer should have known about this, and they should be able to access that. I understand it has a limit of about 50 million per application. So you can have as many applications as possible, depending on your ability to conduct several research at the same time. There was a question that I was expected to respond to. I think, Mitare, you were the one that asked the question about this conspiracy theory. Truly, at this stage of the ravaging effect of COVID-19, I wonder what purpose a conspiracy theory would serve. Because for me, and for a lot of you, I know, and those watching even at home, the figure of infections and the fatalities we have in Nigeria today are not statistics. You can place a face. You can place a name of somebody you know, a friend, a colleague, a relation, people who come from the same communities with you. So for me, conspiracy theories are abstract. The reality of the situation is that, yes, COVID-19 has hit home. I had a colleague who was even instrumental for my appointment as the chairman of the Presidential Task Force. When I was appointed chairman of the Presidential Task Force, I was not the one that nominated myself. It was Mala Abakari that called me. He was out of the country to say that he had discussed with Mr. President and they feel that I are best suited to lead this response. He fell in the line of duty from COVID-19. Do I need any conspiracy theory? Do I need any conspiracy theory to tell me that it's real? I've lost personal friends, a classmate of over 45 years. We met in the university way back in 1976 when we came in as teenagers to read law. The chief judge of a state fell victim of COVID-19. Do I need any conspiracy theory? I've buried people from my community. I don't need any conspiracy theory. You see, the Honorable Minister for Environment spoke in Hausa. How I wish he could translate what he said in Hausa. For people who think that there is a conspiracy theory and they are waiting for the impact of COVID-19, if it were not a public health matter, what he was saying technically was that he wishes them well. That was what he was saying in Hausa. For those of you that understand Hausa, that was what he was saying technically. He wishes them well. But because it's a public health matter that would not stop on an individual, but it has the capacity to invade a whole community, as it is doing now, we have to take up the challenge. In spite of the nuances, in spite of the skepticism, in spite of the conspiracy theories that are neither here or there. I've seen a big country who was involved in a blame game, blaming another nation for COVID-19. That nation has been able to flatten its own curve. It's dealing with some small transmissions here and there. But this big and great nation is dealing with the very adverse effect of COVID-19. In terms of numbers of infection, the last time I checked was over 2 million. In terms of fatalities, the highest in the entire world, 115,000 today, with a projection of 200,000 by the end of September or August. I think the blame game is over. It's time for dealing with the consequences of whatever actions that are taken. So, blame game or no blame game, conspiracy theory or no conspiracy theory, doesn't help in this response. The most important thing is for us to deal with the matter and try to save the lives of Nigerians. There was a question, I think, from Daily Trust as to whether one of the reasons why people don't believe this thing is real, because they have not seen people gasping for bread in our Nigerian hospitals or people on ventilators. I think in the medical profession, like most professions, there is some element of discreet disclosure of certain things. And that's why we have been very, very careful, except for matters that have become public. We don't come up and tell you this man is infected, this man is infected, or that man is infected, because by virtue of the ethics of the medical profession, it is only the person that is infected or is carrying a particular ailment that has the right to disclose what ailment he is dealing with. Not even his doctor can make that disclosure. So we try as much as possible to preserve and respect those principles and those ethics of the profession. We will not want a situation where we will go into a ward, and also to respect the privacies of those individuals, because they have families. They have loved ones that are battling with the consequences of this infection. And not to now make it a thing of public. We will try as much as possible to be very truthful and factual with the issues and the facts, but we will also respect the privacy of the individuals involved. So as long as we don't have those disclosures from the people, we will continue to use figures to describe what our state offers. There's another question that has to deal with, yes, I think it's Voice of Nigeria that asked about NAPIMS, that they have, you said staff of NAPIMS, there is no such thing. As a matter of fact, if it's anything, all we are doing as a government is to ensure that jobs are saved. That is the whole thrust of the Economic Sustainability Committee and the committee that had to deal with the impact of COVID-19 on the economy. That is the whole thing that has to deal with the facilities that have been created by the central bank. The 100 billion facility that has been created for the medical and pharmaceutical industries, and the 50 billion that has been created for the entertainment and the hospitality industry and small household schemes. It is left for you as an owner of a business to be able to validate and justify that COVID-19 has impacted on your business negatively. You will have access to some form of funds. And the essence of those funds is to ensure that you do not retrench or downsize your workers. So we are doing everything. How can we turn around now as a government institution? And as a matter of fact, NAPIMS is an agency of the NMPC. So if anything is going to happen, it will come from NMPC, and there is no such thing happening in NMPC. As a matter of fact, they are recruiting. To the best of my knowledge, they've been recruiting in the last couple of months. They've been recruiting. So they cannot be recruiting and downsizing at the same time. So please advise your NAPIM staff that have been downsized that I think it's only happening in the figment of their imagination. There is no such thing in fact. I believe there is not a thing that we would pursue at this time, considering the major effects of COVID-19 on our lives and livelihood. We will try as much as possible as a government to safeguard what we have. Not only doing that, the essence of the Economic Sustainability report and plan, which was submitted by the Vice President to Mr. President about a week or so ago, is to create more job opportunities, to engage more, to diversify, to invest in infrastructure, to invest in wealth creation, and so many other things. And I believe that will help us pull from our tilting towards recession and put us on the trajectory of sustained economic growth into the future. And lastly, Nancy AIT, I think you asked whether we are contemplating the change of strategy. We would not change any strategy. The appeal now is for Nigerians to change. There's nothing that is going to change in terms of strategy. Our strategy is simple, and if I knew, I restated it in paragraph 4 of my statement this afternoon. I said, I wish to remind all our citizens that the best strategy remains to test, detect, isolate, and treat. That's the only strategy we have. And that's the only strategy that is working. Realizing that there is no cure, either through vaccine or any form of medicine. that is 18 months to 2 years down the line. And the only thing that can protect our people is to do what we have been preaching these last 3 months. And what is that? I reminded and I warned and I finally concluded in paragraph 15 of my statement this afternoon. I said, finally, let me remind everyone that wearing your mask properly, observing social distancing, and washing your hands and avoiding large gatherings are critical to saving lives, including yours. That's all. That's all, and that's the only strategy that is working all over the world. That's the only strategy that is working all over the world. The non-pharmaceutical interventions are the only things that we have put in place, and that's what everybody across the world has put in place. And that flows. And that's the only thing that is working. And our appeal to Nigerians is that that is the way to preserve life. First, your own life, followed by the life of your loved ones, and the life of people in the community. And that's why we arose this afternoon from our meeting saying that, look, we need to drive this message home. We need to get different faces of opinion leaders and shapers of opinion in the society to begin to drive this message, because that's the only message that can preserve us as a nation. You have seen the statistics. We came from just 422, I think, in the month of April. By May, we were 5,000 plus. By June, we had gotten to 17,000. 16th of June, we were over 17,000. By today, we are 20,000 plus. And the figures will keep rising. There is nothing that would stop these figures from rising if we do not cooperate and do the things that we have asked Nigerians to do. And I did mention, through a chat with a media friend of mine, when I said over the weekend, and it was reported in this day, the newspaper, when I said, the effects of the figures we are seeing now will be evident 3 weeks down the line. And that will be evident through the number of fatalities when we begin to count them in hundreds. That's the truth. Because the more you test, the more you find, the more the figures. As a consequence of the hike in the figures, definitely you would expect more fatalities. So that's the bare truth. And we must get responsible as a people to begin to deal with this. And the only way we can deal with it is to begin to ensure, take up the responsibility and challenge anybody that you see within your premises that is not putting on a mask. I've drastically reduced the membership in my household. Even yesterday, being Father's Day, my siblings thought that they would come to my house to rejoice about Father's Day. I said, this father wants to survive, wants to live. So stay away from my house. I want to remain a father. I want to remain a father. So that personal discipline must be put in place. Where your friends will want to say, no, I'm coming over to have dinner or have lunch. For now, please, eat at home. That's the only way. And I believe, going forward, you will help us cascade this message down. That's the only thing that we need to do to keep ourselves safe and, by extension, keep our loved ones safe. Have a good evening. Thank you.
Thank you very much, Chairman PTF. That brings us to the end of the briefing for today. We must thank a number of people. First, thanks to our media partners that have been covering us and taking the messages back to Nigerians. We must also thank Captain Val Thongo and the Allied Air Cargo for at very, very short notice, agreeing to airlift the cargo from Lagos to Abuja on Thursday. That is part of building partnership. And one silent message that has run across all the presentations this evening is partnership. Partnership with the states from the visit, partnership with communities that we intend to engage with, partnership with school owners so that they will understand with us and understand with parents, partnership with parents to ensure that their children don't lose out anything and ensure that they carry on with their studies. Partnership with individuals, you and I, who must take responsibility. Partnership with corporate organizations such as the Allied Air Cargo. Partnership with our development partners, the UN, the WHO, the EU, and what have you. That is what has run across all the messages today. And in this fight, partnership is the major ingredient to help us get a firm control of the situation. We have a choice to make, and there's an urgency of yesterday. This virus does not understand our differences. We are most vulnerable when we are divided, but with solidarity and cooperation, we shall overcome the partnership. Build a partnership across your communities today. Wear your mask, observe social distancing, keep personal hygiene, create awareness and education, and do a lot of sensitization. Play your role, change your behavior. I thank you very much. God bless Nigeria. We hope to see you on Thursday.